Heard, my name is Carin Johns. I'm a physical therapist with Stoughton Hospital. So I work here out of the Oregon Clinic, which becomes urgent care at night, so we kind of do the buildings working all the time. I've been in PT for 10 years. I've been with Stoughton Hospital for almost the last 8 years. And we see a lot of pain in PT, but we see everything. Necks, shoulders, backs, hips, knees, feet, kind of see everything. So we get to kind of running injuries, kind of our high level, people who are coming in getting injured from running, or our athletes that come in from high school. Their injuries are usually right getting back into sports, and they have been off all summer doing very little. And they try and go back into a huge routine, and things start to become painful. So 3 big things for common running injuries that can really improve and reduce your pain: strengthening, shoes, and looking at your form. So I guess the point of this talk is to kind of help people when they start to get injured on their own. Do you need a chair?
Sorry?
Do you want a chair?
Yeah, this is the Stoughton Hospital.
Yeah.
Okay.
Yeah. Is when you start to get injured, things hurt, so you just keep running, but you aren't really addressing the issue, and then you try and think it's going to go away. Then you might go to the doctor, which could be a month later, before they tell you, well, just stop running, take something for pain. And then you come back weeks later and they finally say, well, maybe you should go see PT or look at something else to address pain. So hopefully this can put a shorter time frame in between that injury and you getting back into running pain-free. So the first one, which is the most common thing with running, is patellofemoral pain or runner's knee. So this is probably the most common runner injury that people complain of. When the underside of the kneecap starts to rub on the underside of the femur. So patellofemoral pain, just these 2 bones coming together. When you're running though, they need to glide nice and smooth. It should run right in that groove. There's a couple factors that can make it run a little bit off to the side. And it can cause some discomfort. So a few things that can cause that are when you're standing, if you have arches that kind of drop inward, so if I exaggerate it, you can see my legs. If my arch is dropped, my knees will fall in slightly. So I'm exaggerating this, but just that little bit of falling inward is going to put more medial knee strain each time I'm running. So then you start running and put more force through it, and you get a lot more pain on the inside of the knees. So that's kind of an easy fix. You need to make sure your shoes are up to date. If you start to see tread wear on your shoes, and you can see a pattern on the shoes, it's probably time to get new shoes. 300 to 500 miles of running is usually what shoes will go, and then they start to have breakdown if you want to get a new pair. These muscles on the outside of the hips here, this IT band area can get tight, and if this is tight, it can also pull on this kneecap. So this here is the outside of your knee, your IT band starts clear up in the top of the hip and it runs down to the outside of the kneecap. So if this area is tight, it can actually pull this kneecap off the side. So when you're running, now you're getting this poor glide. The more you go, the tighter it's going to get, the more pain it's going to cause. This pain can be while you're running, after you're running. If you sit for a long time and go to stand up, you might feel like, oh, it's so stiff. And once you move it a little and get the fluid back in the joint, then it feels better. So with that, you can work and loosen up the IT band. Are any of you massage therapists here or massage therapy?
So it's
Yep.
back lives.
So you can do some stuff at home for this with a foam roll. Do any of you have foam roll at home? Yeah. So that can be really nice for IT band. The other component, which I really wanted to focus on today, was the strengthening aspect, because people will tend to stretch and lengthen and do all this stuff to get things to loosen up, but if you don't address the weakness in some areas that people have, you're not going to change. You go back into running, it feels good, and the same continuous irritation will happen again. So what's very common with patellofemoral pain is we are weak on the outsides of the hips and our glutes and our big glute muscle on the backside. And this is very common because we sit all the time and we don't strengthen these muscles very much. So the more we sit, we get tight in our hamstrings, we get lengthened and weak in our glutes, especially on the outside. So now if I try and run, so this muscle on the outside of my hips, this glute medius muscle, it does hip abduction, but it also keeps my hips level. So if I'm running or lift a leg and this muscle is weak, this is going to drop on me and look like this. So so it's kind of hard to demonstrate it. But if I'm here, I drop a hip, my knee will also fall inward. So that's another huge component of this inside knee pain. So it's not that you're actually straining something specific here, it's usually an issue of above or down below at these joints. And it's like, well, why does it hurt here? Because it's just getting too much pull in one spot. It has to go somewhere. So some of the exercises I want to talk about today are strengthening these areas that we're all usually pretty weak in. Another suggestion is when you're running, you can change your stride length. So you increase your number of steps when you're running. So when you have knee pain, you can decrease that strain under the knee by almost 30%. So when you're running, you're just going to take how many steps per minute that you do, and the average is about 160. And you're going to add 5 to 10% onto that running speed that you have. When you increase the number of steps you take in a minute, you're going to decrease how much strain you put on the kneecap itself. You're going to let the knee be a little more bent while you're running instead of into that full extension. And you're going to land more mid-foot instead of on the heel. So it just decreases pressure that's going through the whole leg. So it's pretty easy to do. You just run and you clock yourself for a minute and just count your step on the right foot. It's a little confusing when you try to do both feet when you're running. So counting just that right foot stepping and multiply it by 2, that gives you number of steps per minute. Then you increase it by 5 to 10%. So an easy way to do this, because everybody has iPhones now or some type of application that you can look up, is you can put it on a metronome. So on the metronome I can get to 160 or so. My phone's pretty quiet. But then this is now your new running speed. And once you get used to it, you don't have to think about this too much. Or you can find a song that has this.
Yeah, something.
This will get pretty annoying to listen to. But once you get that idea of where your feet are supposed to be, you can change it. I mean, you want to increase it by that distance, you just up that 5 or 10% and get your speeds up. And it's not a huge change, but it's just enough to shorten your stride length.
So what's talking about the ease, like you're landing for each?
Yep. That's landing for
Which
each.
place there is. Yeah.
Mm-hmm. Yep. Serious talking. It's quicker, it's less impact, it makes your legs a little bit wider instead of being so close together. It lessens joint impact throughout your whole lower body. So if you're not having any issue with pain, don't try and, you don't need to decrease your stride length. But if you are, it's an easy way to shorten things up so you can still run, but not put the amount of stress on your lower body while you're running. Let's see. We talked about this a little bit with some people before we started, but cross-training is huge. If you're just running, you're only going to strengthen in certain spots, so you can get tight in certain spots. So if you're just running, you're going to have, your quads are going to be strong but tight. Hip flexors might be strong but tight, but you're not going to get any of this lateral motion. So doing a bike, if you're using a recumbent bike is good, but like we talked about, if you're not outside, you don't have that stability of keeping the bike up, so you don't have so much of this outside hip work, so outside is best if you can. A recumbent bike still works your quad muscles nicely, and it's a good thing to switch over to if you're running is too much pain, but still keeps your cardio up. Basketball, softball, some people get into soccer, anything where you're now doing a side transition versus just forward. Water exercise, I think I have a lot of people go into that too here in Oregon. That's really good.
Can I ask a quick question about this idea that you're talking about? I don't know where I got it from, but when I need to slow down and catch my breath and while running, then I do, I don't know how to say this, you walk sideways and you put your legs over, then I do the other way, then I go backwards. Is that kind of helping the sides?
Yeah.
Okay.
Yep. It's good. It's a good exercise for loosening up those muscles. You're going to get a lot of stabilization or strengthening. Once you add these bands to it, you'll get more strengthening. But it's good to get yourself just out of that position for a while.
That's what I
Or
do.
doing some side step. Or even backwards. Sometimes I backwards walk in the middle of.
Yeah.
I'll stop and just go the opposite direction. And it is fatiguing because we aren't used to going that way.
Yeah.
So some of the things you can do for patellofemoral pain, you can massage out this IT band yourself, and that can be pretty easy to do. You can use a tennis ball, which of course I couldn't find this morning. But just getting in that, on the IT band and find that knot, those spots that are tender, and stick it right on and just roll it up every 5 minutes. If you have a rolling pin at home that you bake with, I do, but I don't have to bake with it, but I have one. You do the same thing. You roll along the outside of the IT band. This is actually our OT's rolling pin. It's for hands and arms, but it works really well, doesn't it?
Yes, it does.
So you don't want to go right over the bony prominence, but you want to stay in the soft tissue in between. Okay? And you can get up here on your quad, because you might have some knots up here that you don't realize are in there, and loosen it up here. But usually on the inside of the knee, when I'm treating patients, I almost always treat this. I'm not treating the inside of the knee. We're correcting form, loosening up muscles, strengthening, and then we get rid of this inside of the knee. So that's not usually the area where things are coming from.
When you foam roll, do you aim at your muscle inserts? When you foam roll, do you do the whole muscle?
Just like you don't go over these bony prominences, you just roll on here. Yep. And again, if you find that spot, just stay on it and go over it a little bit.
Could you demonstrate this so you can see?
Foam rolling is nice, but it hurts.
It hurts. But there's, watch how she does it.
And it feels better later, not while you're doing it. Okay. So,
You want me to see?
Yeah, it's driving.
Oh, yeah.
if I get here, just roll on.
And those little rollers too, that are about a foot and a half
Yes.
long.
Yep. Those are more runner sticks, so if you've seen those before, they have the little white beads, but they have a little bend around, and they're nice, because you can kind of wrap around the IT band in the quad.
No, that's straight.
Now, you can do a lot more than just IT band on the foam roll. I mean, for quads, you just get over the muscle and roll it. So just going this way.
And you keep rolling, or do you stop where you find a knot?
I stop when I find the knot and just kind of,
Back and forth, short rolls.
yep.
And it can take your breath away. It can be that painful, but it
Short
does
roll,
help.
yeah, it's,
Yes, but it does help.
yeah.
It's just like getting a deep massage and having someone get in there and really work it out.
That's what it means.
Yes. And a lot of times people come in with that inside knee pain. They never complain that this hurts.
No, no.
It's not until I get in there and start poking and testing muscle strength and all that stuff, and they're like, oh my gosh, I had no idea I had that there. Because you don't feel it in here, you feel where the strain is coming out when you're running. Sneaky muscle knots. Let's see. Hip flexor stretching and quad stretching. Most people I see for running, they don't even have a stretching routine. I would say almost all of them. And sometimes they'll run like 15 miles a week, and they do no stretching. So when you're going to get ready to run, you want to do a dynamic stretch to warm up, because they've done studies that show that if you are static stretching, you stand here and hold for 30 seconds before you're going to go running, it actually makes your performance a lot worse. Because you just took all those muscles that you want to get warmed up, and then you stretch them all out. So they aren't in a prime position to work. So before you're going to be working out, you can do like high knees. Getting up, you can do kick outs this way. You can do walking lunges. Anything where you're moving, but it's a dynamic motion. You're not just static stretching. The static stretching you want to do after you run, so you can remodel the tissue. So then you stand and do a 30-second quad stretch. A hip flexor stretch where you get in this kind of runner position. Then a hip flexor stretch. And hamstrings. So those are all kind of after the run.
The hip flexor stretch, you don't want to make contact with the ground with your knee, do you?
You can. Some people need to because they have such a good distance they can go. But as long as you feel in the front of the hip. I mean, I can get like this with the chip and still feel my hip flexor on the front. So as far as the strengthening goes, which is what I really wanted to get to for this exercise, because like I was saying, if you can stretch like crazy, you can really loosen up stuff, but you're not changing your form or your mechanics, your stability. So that first picture there is just a squat with side stepping. So I brought these bands for you. So this will focus on the outside of the hips, and the partial squat hits the quads. So with the band, you'll just do a partial squat and side step. And you can make almost every exercise a core exercise if you just pull your belly button in. So then you're getting your core stability, glutes and quads. Just doing this. And probably get a long hallway if you have that at home, do it a couple times down and back. Squatting. Because I'm in the clinic and I see this a lot, I usually do the bandwidth squatting. So you can just do a nice squat where you're falling down, knees not over the toes. When you have the band there, though, it reminds you to keep your knees apart. People who have this weakness on the outside of the hips, they tend to fall inward on the knees. So you can watch yourself in the mirror and just see if you do this already. They look like this. Because you don't have the strength in the hips to stabilize you when you fall down. So then with the mirror, you can watch yourself and see that you keep a nice deep squat with the legs open. Okay. And I don't know, has anybody here used kinesio tape?
I've heard of it actually. It's, we're starting to use it with horses.
Are you really?
I'm not trained yet on it. It's one of my add-ons that I want to do.
So I kinesio tape the knee a lot because it works really well. So kinesio tape is stretchy tape. It's what you see most of the athletes wearing. You can buy these at Walgreens. I think they cost like $10, $12 maybe.
So like that.
But it's a little stronger than right? Because it's, isn't it kind of, you can change the pressure as you stretch
Yes,
it so it
yeah.
pulls up your skin and the muscle. And
So it's porous. It's supposed to be like someone touching you with their hand and gliding your skin, and it'll stay that way. So it helps with swelling. And if you use a little bit more stretch, it can help with stability. Let me get this piece off. But just to show you what it looks like. It's very porous. And it does so well with decreasing inflammation that if you have a bruise, you just take a piece of this and stick it on there, your bruise is pretty much gone. And you will actually see those little pores where it's just pulled the fluid up. And all it's doing is kind of lifting the skin up and letting fluid move through easier. So the point of it with the knee is to unload the knee. So when your knee is quite painful, I'll show you real quick what this looks like. When you buy these, they have little inserts in them that show you what you can do for common injuries, knees, shoulders, ankles, backs. So they have little pictures for you to show you how to do it. But the knee one is pretty simple. So I'm going to demonstrate it really quick. Because again, this can keep you running so the pain is not so intense and you're damaging your calf so much. This other one I bought, that K-tape, I think that one was from Walgreens. They're already pre-cut for you. So with this one, you're going to keep the knee bent, so you're just going to lay it down. You don't want a lot of stress on it. So it's going to right at that quad insertion. I'm just going to lay the fingers down. So with my knee bent, I'm just going to lay it down around my knee with not a lot of stretch on it. And the ends, you don't want any pull on those. It's very sticky. The more you rub it, it's heat activated, so the more it will stick. So that's for quad. And then going up, I'll actually put a piece up from the lower bone. And sometimes the tapings look different in the packages, because they might not do, there's a lot of different ways to tape. But I'd say this is probably the one taping I use the most. Arthritic pain, it works well for. Running injuries.
So it's just for injury, it's not prevention, you wouldn't wear this.
No, this is
Every
when it hurts
day,
you.
yeah.
Just trying to make it feel more comfortable while you're running.
Okay.
It's that little bone, lower bone down there. By the bottom. Because what you do is you're unloading the joint, so it's comfortable, allows fluid to move. So you just do that. Take a little lay down. Again, you're not really what you're doing, you're already bending the joint. So that is it. Now when I straighten out, see all those wrinkles? It's like it just takes my kneecap and lifts it up. So you're not getting that compressive force under the kneecap. And let's really just move easier through so your inflammation doesn't sit in the kneecap. You can't really tell you that on. So it's not going to feel like it's really tight or really uncomfortable. It just feels very loose. So that's a suggestion. And this is nice because you can buy it and you can use it for different joints, not just knee, foot, ankle, kind of everything. So that's kinesiotaping for that area. You probably heard people talk about meniscus pain in the knee or they had a meniscus injury. When you have a meniscus injury, that's usually more pinpoint pain. There's usually some twisting involvement in it, and it's right on the joint line. So this is the meniscus of the knee, cartilage there in the middle. Your pain will literally be right on. You can pinpoint it and say, this is it. It hurts when I'm twisting, it hurts when I do a deep knee bend, and it's just always there. I can do all this stuff to try and get it to go away, and it's just very pinpoint pain. That's the most indicator that we use to know it's meniscus pain. They come in, it's right on the top of it. So with that, I probably suggest you go get an MRI because meniscus does not heal well. It's very clear and white because it does not have a good blood supply. So once it is torn, I usually have to do a meniscectomy. They go in and they just find a little flap that tore off and remove it. So that can be arthroscopic surgery, but they have to still usually get it out of the way.
So minimal pain, you don't do anything, but more sharp pain?
If it's sharp and very pinpoint over right at the knee joint. And if you do all of this stuff, you iced and you rested and you taped or shortened your stride, all that stuff you've done and there's no change to it, and it's still pinpoint, then I'd say, something else is going on here. There's usually something you remember with it. You turned or you slipped and you twisted on your knee, or you're running and your foot came out underneath you and you twisted. Usually something like that brings on a meniscus injury. Another big sign of meniscus injury is your knee will actually lock. So if that little flap or that tear gets stuck, you'll get your knee so far, I can't even move my knee. And it can get stuck there for quite a while. So that's a definite sign that your meniscus is in the way. Kind of blocking the motion. So the next one I have in here is IT band syndrome. This really goes along with the one we just talked about for the patellofemoral or runner's knee. But this, you'd actually feel the pain in the IT band. I don't even get people come in for IT band pain. They come in for pain right over the bone of the outside of the hip. So this, on our hip, we have this big IT band that runs down. There's a bursa sac that sits right there. So this bursa can get irritated by the IT band if it's tight right back over top of it. So foam rolling that IT band can help relieve it. But the biggest thing for this one too is strengthening the glutes, all those hip muscles on the outside and backside. So what we showed you that squat before, you can do that squat, but you can change it to a single leg squat where you're dropping down. So this is more challenging, obviously, because you have to keep the hips level and perform your quad strength. So it's just a progression of that exercise, doing that. Again, cross-training, biking, swimming.
What if I was keeping an issue with pain is on the outside of the knee?
That is, so I don't know if you can see this, everybody, but if you can see this IT band right here, it comes down and attaches right on the outside of the kneecap. So that's why I was saying, if it's really tight, it will pull that kneecap off to the side. So it can be causing that little pull. So for some people in the clinic, I would actually do a taping with a rigid tape and grab their kneecap and pull it inward. And that can relieve, it just lets it glide where it's supposed to, but relieving the tension on this whole IT band. And sometimes you can just have a muscle knot on the outside of this quad muscle. Because you have, four muscles coming down here in your quad muscle. So the outside muscle, which is right underneath your IT band, can get that. So you're like, what is that? There's not even a muscle there. Well, there is. It's just below your IT band. But that's usually that pain you feel. It's the insertion point. Achilles tendonitis. This is more men than women. On this picture here, you can kind of see, here's our big gastroc muscle up here. It's big, it's a very strong muscle. It comes down here and attaches right to the base of the heel. This muscle, people also don't really come in with pain in the muscle belly itself. The pain will either be on the plantar fascia, on the bottom of the foot, or right where everything inserts. So these two big muscle heads come in and insert this really tiny point here. So the pain is usually right over the tendon, and you know when it's inflamed, it's sore, it's swollen, and it really hurts right on the backside of the heel where that tendon sits. So not necessarily the muscle itself, you don't feel it there too much. But
Why more men than women?
my theory is that you guys have the longer stride length, so you land more with a heel strike versus the midfoot. So that it just puts more pull on your calf and you're hitting harder to the heel. Let's see. It tends to flare up a lot of times with people who increase intensity way too fast. Your muscle wasn't ready for it, the strength wasn't there, you weren't stretching, and you really push yourself really hard. And when it comes on, this is not one that you want to run through. You definitely want to take a week or two off. Just let it resolve, ice it. Otherwise, it can become a very long, chronic standing issue where as soon as you start running again, there it is, because you just haven't addressed the underlying issues. Icing is very helpful with this because any itises, inflammation of the tendon, tendonitis, change definitely from biking, swimming, and running in the pool. Calf stretching, massaging on the foam roll. I don't think I did show you that one. For the calf. But you can get on it and just put your opposite leg over your leg that's sore. So it's up higher, you can kind of get right on that spot. It's lower, just bring your opposite leg down. So you put some pressure right in the calf itself.
So you're doing the calf muscle and the tendon coming down?
Not the tendon.
Not the tendon, just
No. Mhm. Yep. Tendon already hurts. That's where all the inflammation is. So just roll off the muscle. But you'll ice right over the tendon to get the inflammation to go down. You can foam roll or you can use the roller on your calf. It's a little more difficult. It's easier if you find somebody else to do it for you. And they will also push a lot harder than you will because they don't feel it. But it works really well. You can kinesio tape the Achilles tendon, and that's an easy taping. It's a very easy taping. This one I use mostly on my teenagers. For some reason that's what I've had lately. Girl has this issue. But do you have an Achilles issue right now? Do you want me to tape you?
Sure.
Okay.
You're on your both sides, but this one hurts.
All right. So, yeah. You just go here too. Is that easier? So you want this to go on the bottom of the heel. So it has a strap to kind of hold it in place. And you want to measure up to about the top of your calf. All right. So you probably saw me around the edges here. Just makes it not fray off so quickly.
When you shower and stuff, and this just stays on?
Yep, usually stays on like 3 to 5 days. And it does pretty well. When it starts to fray off quite a bit, then you'll probably want to change it. Let's see. Let's do your other leg first. You said they're both kind of bad. We'll do both. This will make it a little bit easier to see. All right, so turn kind of this way. Just let your leg fall outward. Let your knee kind of bend and fall. There you go. All right, so we're going to strap this to the bottom. And again, any of your anchors or the ends of the tape, there's no pull on there. You just want that to stay on. Now, you can rest your heel down there. We're gonna come up and around. This is where the pain is, over this Achilles tendon. So I'm gonna have her pull your foot up as far as you can. Nope, this way. So you're gonna really put that tendon on a stretch. And I'm gonna put a nice big stretch. So this is about 100% of what that tape will do. And lay that down over the back of that tendon. So now you're putting yourself on this full stretch of the tendon. So when she relaxes down, it's not really gonna let her push that all the way up through full range and take some of the strain off of it. All right, just do this. Just lay down, no stretching here. So that's what that will look like. Do the other side since we're here with shoes off. Any questions about the taping? Like I said, most of them have inserts in them, so they'll tell you the major things: knee pain, Achilles pain.
So you just had her flex to the highest
Yes.
possible degree that she can flex.
I had to put that on as far a stretch as she could get. And just while you're laying it down over that tendon. So this one. Not the place I want to wrinkle.
PT, when they measure the basal and knee flexing, this calf is more tight.
Yeah.
because I'm having pain.
Yep. Did they find a lot of muscle knots in your calf?
What did it match? So then try to just do more of those stretch and out stretches.
The next exercise is going to help you tremendously. Just up along the calf. Might be a little off to the inside, sorry. Usually when I do this to people at work, I have them on their stomach, so I have a perfect view of what I'm doing. Side taper.
Thank you.
Yeah. So then you just keep it on for 3 to 5 days. In a couple minutes, you won't even feel that it's on there.
Yeah.
But the other part of this protocol for Achilles tendonitis is eccentric strengthening. So if you know what that means, it's strengthening while you're lengthening the muscle. So they've done a lot of research with like in the last 5 years on this type of strengthening, where you're actually putting a lot of strain into the tendon so you can remodel the tendon itself. So an eccentric, you've seen calf raises. You've probably done these a ton with your issue, doing these.
Yeah.
This is a concentric contraction. I'm just straightening through the range. That's not going to change a lot, which they've showed that in the study as well. But on eccentric strengthening, I didn't want to bring a whole step, so if I fall over on this little thing, don't mind me. So this is my step. It's stable. I would go up on both feet onto my toes. I will lift, drop down really slow, all the way on the injured side. So I'm strengthening and lengthening the whole way down. So up for about a second and down for 3. So like that. It will feel a little bit painful because it's supposed to. You're going to be changing the tissue right in this huge tendon. I mean, it's big because you're trying to remodel this tendon. A little pain is good. A lot of pain, obviously, it's too much. But a little, you're going to work into that pain. So what this study showed is when they did this strengthening protocol, they did 3 sets of 15 twice a day. They did 90 repetitions a day for 12 weeks. And that in 5 weeks, people were running. By 12 weeks, they were running with no pain. So when you can do 90 a day and it's not painful, then they added a weighted backpack. So they had some resistance. Yes. So now you have, it can be anything. You have like a little ankle weight and just rest it on your shoulders. You can hold just dumbbells if you feel like you can keep your balance. But anything that gives you a little bit of weight. And you're up and dropping down. So they found that this exercise was superior to anything we were doing before for Achilles tendonitis. And it does work really well.
Is this a good just prevention exercise too that
It
we
is.
should incorporate?
Yep, because usually when you start really upping your routine, your strength isn't really there,
Right.
or you're not stretching at the end. So all of these are good. As far as the stretching and strengthening exercises, they're all good ones to do as a preventative. Hamstring strain. So this muscle obviously is backside hamstrings running from your buttock bone, the one you sit on, down to the backside of your knee, and it bends our knee up. Or if I'm bending forward, it also helps me come back into a upright position. Everybody is weak here. Nobody's strong here unless they go to the gym and just do hamstring curls. Because we sit on it all day. Our rear end is the same way. Our glutes are just weak. Unless you're working them, we just don't use them enough in our daily activities. So our hamstring can either be too stretched out, and if it's too stretched out, I mean, you can lay down and do that hamstring stretch, like, wow, this is easy, I'm all the way back here. I don't have any problem, there's nothing wrong with me, I pull this motion. Well, you have so much motion that, say if I take my finger and I pull it all the way back, now I have no strength. You know, I can't really pull down very easy because I'm now at the end range of that muscle, so it's not going to work very well. Now on the other end, if you sit all the time and you're really tight, now I'm here, and I don't have any strength either because I'm not in that mid-range where I'm really strong. So if you are tight, definitely stretch your hamstrings, but then you have to start strengthening your hamstrings. And these are a really good exercise for back pain as well, because this whole back component, if you're not strong back here, and it can help us do back extension, then our back's going to be doing all of that work, and our back can start getting painful. So hamstrings are easy ones to do. I think I showed you that hamstring stretch if you're here. Doing this after your workout, 30-second hold, stretching your hamstrings. If it's before your workout, that dynamic part, these are really good. So you're getting that hold on the backside. Now for strengthening, bridges are a good one. So if you're down doing bridges, hope y'all can see me, you can move up. So here's your bridge. I'm sure everybody's seen this exercise before. But in this position, I'm getting my core, my glutes, my quads, and my hamstrings. So this is a good exercise. When that gets easy, you're going to take it to a single leg bridge where you're up here doing this. Okay? You're going to hold for 10 and be lifting. And you're going to feel your glutes and your hamstrings. You're going to feel it in your back if you aren't tightening your core. Okay, so this lift. And you can see pictures clear up here when people are doing this. So whatever, as long as your legs up in the air and you're challenging yourself to lift up the hamstring. One-legged deadlifts, if you've done these, you'll definitely feel these as well. So this exercise is all hamstring. Have better balance if ever used that side. So if I'm here doing a one-legged deadlift, and you drop down and back up. Get to the top, you want to really squeeze your rear end. Down. If you do 10 of these, you're going to feel exactly what muscles work. Right in the hamstring. Then foam rolling the hamstrings. Kind of like the calf, just up higher. Rolling. Then they go right into your piriformis, your butt muscle, so you can cross the leg over to the side. Roll into that muscle as well. This one feels great. This is one of my favorite on the foam roll besides the ITN. That one just hurts. This one I think feels good. So it's an easy, like you can do 5 minutes and go through all of these muscles. Piriformis, backside of the hamstring, quad, IT band, loosen everything up. It's kind of like you just gave yourself a personal massage without having to go get one. So plantar fasciitis. This is actually little miniature tears in the bottom of the foot in the plantar fascia. There's a good picture in here. I don't think so. It's kind of a really tiny picture to see. This is just the bottom of the foot and how much muscle tissue is in the bottom of the foot, and there's a lot of it. So right over top of that is your plantar fascia. So almost everybody who I treat with plantar fasciitis, I'm treating, again, the calf muscle. Big strap muscle hooks to here, plantar fasciitis hooks to here and goes out this way. If this is really tight, my motion has to come from somewhere, so then my plantar fascia starts really forcing itself down and overstretching, and then it causes me pain. So almost every day I treat for plantar fasciitis, I'm loosening up the calf muscle, stretching, massaging, and then some strengthening. A good stretch for the plantar fascia is toes up against the wall, doing this type of stretch. So I really feel my calf and the bottom of my foot with my toe up. Or you can also just, like this middle picture shows, you can grab that big toe and just pull it back. While you're in this position, you can just do some massage on that tendon and bottom of your foot. What a lot of people miss out though is that the back is so relevant with everything you do. If your back is weak, that can be a contributor to plantar fasciitis. So some people, you don't think about the back being a contributor at all, but I lay them on their back. I raise their leg up, ooh, I have nerve pain all the way down. I feel it all the way to my foot. So when you try and keep going against that nerve that's tight or straining the back, you'll feel it down here. That nerve is just straining the bottom of your foot. So adding some back stabilization is always a good exercise. That's what that bird dog exercise is there for. If the bottom of your foot is very painful, you can get a resting night splint that you sleep. And the goal of a resting night splint is just to wear it and not let the foot fall down. So when you sleep, it just sits in neutral. So it can heal on the bottom of the foot overnight without being in a shortened position. So anybody who's had plantar fasciitis will get up in the morning and go, I can't move my feet. Until it's been a little while, things loosen up, and then it stretches out and I can put some pressure on my foot. This sock, if you wear the Strasbourg sock, it just looks like a long sock that comes up to here, has a little band, and you tighten it. The biggest thing people do wrong with that sock is they grab it and pull it really hard. Then they hook it, and their toe is stuck in extension all night, and then it causes pain. Oh, that didn't work. That sock didn't do a thing for me. But you're supposed to wear it just in neutral, so it's just holding your foot up. And that can work really well. Shin splints. I don't see these quite that often, I think, because shoes have gotten so good. So if you get fitted for a really good pair of shoes and you're wearing it and not over-wearing your shoes, the front of the ankles can feel really good. But the calf can be very tight. That's usually causes shin splints. So if this is tight, you're trying to force yourself against this tight calf. The muscles in the front are having it really hard to pull upward. And if you're really pushing it hard, you can even cause yourself a stress fracture right in the middle of the tibia. So if you have pain there, so let's say with shin splints, you stop doing your activity, you stop running, you shouldn't really have much pain when you're walking. If you do have pain when you're walking or you hop on it, it just kills me, I would say we're doing an x-ray, because then it could be a fracture. But usually you stop running, it feels just fine. It's not putting too much strain on it. That's not too much of an issue. This you can do kinesio take for as well. And that one's a pretty easy one. That one, this side. Anybody here have shin splints? Not too much.
She does.
Do you? Do you want me to tape you?
No, that's okay.
You sure?
It feels really good. Have to try it.
That's pretty good.
It's
I'm just going to go
amazing.
from here to here.
Yeah.
Either did I, but you're not close enough to tell them. So, I'm just going to do a piece of tape that's kind of the length of your shin. At least these aren't complicated. They're really hard to mess up. The worst thing you could do with this tape is if you put it on, you can pull it all the way. Every time that's going to knock those. And it won't be doing what it's supposed to do anyway. So point your toe down. Attaching right there. Right up to the end.
the soft tissue alongside of
Yeah,
the.
right alongside the bone. And then there's always that spot where it really hurts. And you're gonna put one piece right across that. So you're just cutting the edges off. Wasn't gonna do it. So now this piece, because you're going right over the spot, you want about 50% stretch. So when I run, I know it just kills me right here. I'm gonna go over that spot with a piece of tape. 50%. Right down. And when you're running, it's going to be kind of lifting you up right off that area. So you don't put so much repetitive strain right there. But calves, I really loosen up your calf muscles. So they're not too tight. Any questions about that one?
Nope.
Compression sleeves, have you tried that?
I got them.
Did you like them?
I do. I sleep in them sometimes after running because I run at night. It's only at night.
Yeah.
I come home, take a shower, and I put them on, and I fall asleep.
And they're nice.
They are.
So this is kind of similar to it. That just covers the whole thing. It keeps your muscles nice and warm. You can get compression stockings at Dick's or any running store has them. Even hamstrings, you can get them for hamstrings. I've also bought them for people for that too. Where they kind of go here to here. Or you get a really good running short. And the shorts will come to here, so it covers the back side of your hamstrings. It just keeps it warm, nice and tight and stable. But those work really well for people too. General exercises, all the ones I've given you, like we said, they're great to perform because they keep you strong in those areas so you don't get injured. If you go to a store for shoe wear, I know Fleet Feet and Endurance House both do running assessments. Where they will actually watch your feet to see where your pressure points are and how much compression you put on them. And they will put you in shoes and actually run them in the store. So they can be an expert and figure out exactly what to put you in. If they are not comfortable, they will not be comfortable when you leave the store. So you do not make those pair of shoes. You need to be comfortable when you leave the store. Even if they say, oh, well, those aren't the ones I definitely suggest for you. They feel good, that's what I would go with over their suggestion. But they are very helpful, at least steering you in the right way. These are a few you can choose from. Pick which one that's best for you. If you do have arches that drop, and they're just mild, so you stand and your inside just falls down a little bit, I would go with a nice cushioned arch. You can find those even at Walgreens where it's just a little lift. They're soft, so you can kind of fall into them nicely. The only people who I ever put in a rigid arch support, like a custom-made rigid one, are people who probably not watch people's gait like I do, or you see somebody walking and the inside of their heel just kind of falls down. You can see those people. They need to be posted, like you need to lift it up and hold them up. But if you put it in someone who has a pretty good arch, with that hard arch support, it's going to just be painful. So you just want a nice, soft cushion support. Even super feet, I think, are a little too rigid. If you find a good pair that's okay, that's good, but even they have a little too much support.
Did you say gel? Did I miss it? The ones that have more gel in it inserts?
Or gel.
Better than the foams?
No, they're about the same, whichever one's more comfortable.
Okay.
But I usually suggest the whole foot. So if you just do the 3/4 inch where it kind of falls off here,
Oh.
and miss the top of the arch. So you know about this because I mentioned it to you. There's another app on your phone called Coach's Eye. I don't know if you guys have ever heard of that. But Coach's Eye, you can take a video of yourself, so you can have a family member or somebody watch you running, either on a treadmill, just in your hallway at home, but then you can see kind of what your form looks like. And it's a free app. So this is just an example of it. And so this is a guy, obviously not running, but he's going to swing the bat. But what's nice about it is if you're like me, I have to really slow things down because I don't see it when it happens so fast. So I can slow-mo him. So running, it's nice because you can see if your hips stay level. You can see if your heel is falling inward, the inside of your knees are crossing the midline. When you're landing, you can see all that in nice slow motion, and you can see it right on your phone, then you know what to correct when you're running. And studies have shown that if you just correct it, what you see, you try and tighten and keep your hips more level, you don't overstrut, shorten your length, that all can help in pain. So just knowing those things and seeing it, you don't get to see yourself run ever. But now you can. So, but of course you can come see a therapist so we can watch you run too. And tell you what you should do. Or a mirror, if you have a mirror or something in front of your treadmill. Like just bring a small one from inside your house and put it there to see yourself run your performance. But if you're like me, I need you to run really slow so we can see your performance. That's why this is really helpful for us. And the coaches. There's a lot of information.
Do you recommend hydrating before the run? How much
Yeah.
hydration is good? A cup
Just-
of water?
Yeah, that's okay. Yep. Then your muscle has something so they aren't so depleted.
So on that, is there a rule of thumb that, like after an hour running and you're still running, do you do those, would you want a little bit of water with you?
A little bit, yeah.
Okay, after an hour is about
Yeah.
when you should have, okay.
Yep. Just to rehydrate. Maybe more if it's really hot or humid.
Going back to the patellofemoral
Mhm.
pain, is there an involvement of the hamstrings? Like say your hamstrings are really, really wound up,
Yep.
would that cause your kneecap to come out of place in the femur?
It does just because it's kind of like the calf and the plantar fascia. Your quad is now working really hard against the hamstring. So if it's not loose back here, you're going to be putting more strain right over the kneecap.
Gotcha.
And anything that compresses this down, you're going to have more grinding. It's also called condylation patella. I don't know if you guys ever heard that terminology before. That just means rubbing on the underside of the kneecap. But it can get to the point where it frays, and they can show it on imaging. It's like a fish that you're just filleting. Yeah. So it's really important to catch it early, and the sooner you catch it, you make these changes, you don't go into that chronic pain. Go to the doctor, see if that works. Go to the next person, see if that works. And then it will recover a lot faster. But just doing these preventative exercises, extremely helpful. And it can be any kind of core strength. And it can just be going to doing a anytime fitness class or some gym membership where they're working kind of general muscle groups, back, core, something that takes you out of your normal routine. Or if you just run all week, 5 days a week, take one of those days and bike ride. Or do something that's just a little bit different to offset the muscles that you're working all the time.
One day a week of offsetting is enough.
Yep, just doing something that's a little bit different,
Okay.
muscle use. The strength training is huge, and I think a lot of people miss that. Even therapists sometimes miss that, where they, oh, you gotta stretch here and just loosen you up, and you go, but that doesn't take care of what the issue. They might keep coming back, and be repeat visitors where it's like, well, I'm doing everything that you told me, and why is this not continuing? And just as an example, some people will go for quite a long time doing the exercises, oh, I feel so good, I have no problem, I'm running just how I should. Well, now I have pain coming back again. While you're doing exercises? No, I stopped a couple months ago because I was feeling so good. I'm still running and doing all those things that I want to do, but then it started to creep back again. Just because you're getting out. Unfortunately, it takes so long to build muscle strength that it takes very little time for it to just dwindle away. And our form goes right back to where it was.
So timeline, yeah, it seems to take, so plan on just doing this most days of the week and expect improvement over the next
3 to 4 weeks. Yeah, before you show like the muscle strength happening. Except for the Achilles tendonitis, it takes a little bit longer. Probably put in the 5-6 week range for less pain. 3 months before you're, oh, you feel really good.
In Oregon, we've got the track. I think there's times that you allow it on it. I avoid the asphalt, even though we got all these trails and
Yeah.
sidewalks, and I'm running on grass. And my kids in that track used to tell me, I'm gonna sprain my ankle if I'm on rough terrain. But I really like the grass. And
Because it's soft and compressive.
yeah,
Mhm.
what do you think about asphalt track?
As long as it feels good to you, it's fine.
Okay.
You're not running really unleveled surfaces, and you know what the surface is like where you're going.
Yeah.
But the track in the high school is actually made of rubber.
Rubber, so
So it's a little more cushiony.
that would be better than
It's really nice.
asphalt, but not as
It's really nice.
dangerous as the rough terrain.
Yeah. Yep.
Just the parks.
Just don't go running 10 miles on the track in one
Yeah.
direction.
Yes, I was just gonna say
Oh,
that.
yeah.
Or don't stay on the bottom one where there's a
You
little
get
bit
sore on
of
that side of the
the.
lane.
Yeah.
Then switch and go the other direction.
Okay, switch directions.
Yep.
Does anyone know when it's open to the public offhand? So I see the public out
I'm
there.
not positive. I just know they're walking inside the school in the winter.
There is, okay. So long as no one else is Friday.
It's usually open whenever there's nothing going on.
Yeah.
Except for during like graduation.
Yeah.
So I might get off the week before graduation because of every, stuff that the kids used to do.
Yeah.
But
Oh,
yeah,
yeah, I know, we walked
Behind
around
the
there.
bleachers already.
you could go behind there, or if you go like where the high school football team comes in, you've gone in there too.
And
Sometimes the gate's locked and you can't get in, but
Most of the time it's open.
Yeah.
Okay.
So we can actually use the track.
Yeah.
Any other tips?
That's how I started. That's how we started.
Oh, nice.
Any other tips that you haven't mentioned in terms of increasing your miles? So if I want to go from like 7 to 10, 10 to 14, other than what you said, the core, building up
Yeah.
strength, doing that maybe 3-4 times a week, as well as
You
your
only
runs.
build up to 10% a week. Very, very little.
How many days per week, I guess, is what I meant, like doing the strengthening.
How many days a week doing strengthening?
Yeah, in order to,
I would probably do 3 to 4 days a week.
okay.
So you do like every other day, so you have that muscle time to rebuild the day after, and then you strengthen again.
Okay.
And the day after.
So
If you
don't
just-
do it after every run,
No.
the strengthening, okay.
No. And if you just want to increase running, like 10% is what you're going to do each week. It's very little. It's very little. So you add like a minute or two to your run. You're not ever going to be like, oh, okay, now I'm going to run 30 minutes, and next week I'm going to run 45 minutes.
Okay.
So it's a really slow, gradual build up.
Okay.
So you all those muscles have time
10%
a week.
a week.
And if you do like the Couch to 5K, it's really good because it's all laid out for you on an app where you just, you get 30 minutes to run, you're going to do a minute on, you're going to do 30 seconds off, now you're going to run a minute and a half, you're going to do 30 seconds off.
A book you might enjoy when I trained for my first marathon, Galloway's book on running. He has a couple of different books,
Okay.
and he has schedules on how to build up duration and distance.
Including strength training and.
Well, not necessarily that, but if you're looking to build mileage, it tells you a really sensible course.
Without overdoing it and straining
Right.
yourself.
Mm-hmm. Jeff Galloway.
Jeff
Okay.
Galloway.
Yep. Yeah. And some people who are really energetic, like you can do your run for the day and have one of those strength training exercises in it. So you get down and you just do 30 squats. And the next day you might do your run, and at some point during that run you stop and you do the single leg or the bridge, bridging with the single leg up, and do 30 of those. So each day you can kind of fit in a different exercise.
While you're warm, you don't want to wait and do it later in the day? Okay.
No.
do you suggest more like 1 hour 30 versus 2 or 15 or?
No, as long as it feels good for you, you can put them all together if you want, or you can break it down twice. The Achilles one is very specific because that needs some time to remodel the tendon on that heel.
So I've been running about an hour a day for 5 days out of the, 3 days, 1 day off, 2 days, and then piling on strength afterwards. So is that a recipe for injury if I'm just doing just too much?
How many days a week do you do strengthening?
Well, 3 or 4 of these different core exercises after the run.
No, okay, no. Because you're really working muscles that are opposite the ones you're working during running.
Okay.
That's what keeps you from getting hurt. So you have this nice, good, stable form when you're running. So it's not like you're running and you get done and go, hey, I'm gonna do kind of these, what you just did when you were running. So you're doing something very different.
Like Pilates type
Yeah.
things, okay.
Yep, yep. But we're always there if you want to come see us. I mean, for runners, I almost always check core strength, hip strength, knee, ankle, range of motion throughout all of those areas. Even sometimes upper back, because people sometimes will run with the posture kind of forward. So
Do you ever come across, and some president talks about neutral pelvis?
Hmm?
And how does that work when you're running? You're trying to work a lot of it with our riders
Mhm.
on horses because basically are not neutral. The way a horse works doesn't well, it works, but we're actually can cause more shortening of the usage of a horse.
With almost everybody, we just teach them what a neutral posture is. So we will sometimes work on the pelvic tilts, but we just show you, this is an anterior, this is a posterior, and this is midline.
Okay.
Then your transverse abdominis is a very important muscle. When you strengthen your core, it literally is, the muscle just looks like a corset that wraps around. So when you pull the belly button in and tighten that, this is my neutral core, then you're at least stable here, and it's just your legs working.
So if you're in neutral, so if you have it slumped and
Yeah.
top and standing, you can even knock me off.
Mhm.
But if I were in neutral, then it's going to try to feel where everything more stable.
Yeah. Yep. And you've probably seen people, we see this actually a lot. People who sit, because almost everybody has a sitting job now, but they come in, they have the no butt thing, or they're like this. This is tight hamstrings, weak glutes, your flattened lumbar lordosis, so they're kind of stuck in this pelvic tilt, and they literally look like this. They come in like this. So you have to teach them, like, stretch out your hamstrings, you gotta strengthen here, you gotta strengthen your core, where is your neutral? We need a little bit of curve somewhere.
I play with neutral all the time. I'm on this job and this job, and I play with it all the time when I'm sitting.
Oh, yeah. Yep.
I pick it up, I get up, I roll 15 minutes, and it probably drives my boss nuts, but I don't care.
And I give people too, like if you go to YouTube and look up a 5-minute desk exercise, they're all over the place. And it's just to stop yourself and for 5 minutes you sit there and do, feel these, you twist. You know, you go into extension, you go anything away from what you've been doing sitting. But it's nice to have somebody just talk you through it. 'Cause I'm lazy, it's easier than having something sit next to me, do this. But if someone's talking it to me right in front of me, oh yeah, I can do that. It's a lot easier. Anything else? Good, I hope that was helpful.
Very, thank you very much.
It was a lot of information. But this stuff is nice, and it's not terribly expensive. Yeah. Are you sure? Oh, yeah, absolutely. Absolutely. Thank you. I'll see her again, so it's okay. So if you want to try any of these, you can. These bands, if you want me to cut you a band, red is not as strong as the green, but you can use these easy for side stepping and squatting, the bridging, regular squatting, you can use it with any of those exercises. So if you want one of both, I can get one of both for you.